Uh, Again, now coming towards prevention aspect, what do you do for preventing of chronic kidney disease? So diet is an important, diet plays an important role, and depending on where your kidney function is, you would kind of get help from like a dietitian or so, if you want to go through all your, like in more detail. Physical activity, just being healthy, is not only good for kidneys but every other, like just being in healthy to being other organs as well. There are certain nephrotoxins which can play an important role in forming chronic kidney disease. Commonly, over-the-counter pain medications can play, if you're taking on a sustained basis for a long time, they can cause kidney damage. Smoking has been shown clearly in a lot of studies, kind of implicating having increased risk because of hardening of the blood vessels secondary due to smoking. And basically controlling high blood pressure and blood sugar, if you are diabetic and hypertensive, also plays an important role in order to how the chronic kidney damage is going to progress. So as a nephrologist, our role here is to pick up, like as family doctors, they have a role to pick up them early and refer to nephrologists. And as a nephrologist, we will try, once you are with us here, to see how can we move the curve to the right, basically by avoiding the nephrotoxins or controlling the blood pressure or controlling the blood sugar. So somebody presenting at who is, if left untreated, will progress like what we are seeing on this at D. We will try by medications to get you up to C, basically to kind of delay the progression, delay the end stage chronic kidney disease. But we can't completely stop it once it's already in a stage where you have chronic kidney disease. So there are this, probably people at the back may not be able to read. Basically what this is there are a lot of lifestyle modifications one can do, and basically again these are standard lifestyle modifications which are not only good for the kidneys but from the cardiovascular disease point of view. Basically smoking cessation, which we talked about, weight reduction, dietary protein control. This is more kind of from kidney point of view. Basically a protein controlled diet is recommended for adults with chronic kidney disease, and a dietary protein restriction should be with a careful monitoring of the nutritional deficiencies. Alcohol intake again in moderation. Exercise does play an important role, and dietary salt intake. Like this is again an important aspect of how you're going to if you have chronic kidney disease. And basically what the recommendations are: a dietary sodium intake of less than 100 millimoles a day is recommended in addition to well-balanced diet, and patients who have hypertension, it's much more stricter. So eating healthy, eating properly along with keeping your daily calorie intake and salt intake also plays an important role. With regards to the fluid intake, normally there are patients who come and talk to me, increasing amount of water probably is healthy for the kidney. Like this is not supported by any research data. Like it's not necessarily that you drink lots and lots of fluid. That doesn't mean, like our thirst mechanism is an important way to understand how much one has to drink. You don't get dehydrated if you are in a desert or something, or then you, like again thirst mechanism will drive that. So just drinking too much of water or something, like by flushing the kidneys, it's not backed up with scientific research yet. So we talked about this, basically looking at cutting down on your salt, protein, looking at the protein. If you're diabetic, you kind of keep a watch on how much amount of sugar and keeping a watch on your blood sugar. A lot of, like if you can see on this slide, basically the salt proportion in restaurant food, which kind of is quite high as compared to the home food or so. So restaurant food, like you have to watch for, and then adding salt on in addition to the cooking also have to be careful. Exercise and kidneys, just not kidneys, every other, as I said earlier, it's just very cardiovascularly healthy as well to have exercise. I don't have to go through all the details about this. 20-minute walk 4 to 5 times a day at least would be something minimum which can be done. If you are hypertensive, then treating your blood pressure, reducing the risk factors, controlling your lipids also kind of are important. Medications, there are certain medications including painkillers, there are some antibiotics which are kind of toxins to the kidney. So you have to be careful, and especially more careful if you have already established chronic kidney disease. If you have already your kidney function is lower, then as far as you can avoid, it would be a good idea. Some medications are safe with the kidney, so you talk to your doctor about which medications you can and cannot take. Natural products, again herbal product, controversial thing. We have seen patients coming with different herbal products. There is an disease which is already labeled called Chinese herbal medication, like Chinese herbal nephropathy. They have something called as aristocolic acid, like which are commonly used. That can be quite harmful to the kidneys. Ayurvedic medicine, some of them have heavy metals, so have to be careful. It is before you take into. So generally we don't recommend it. Natural product does not mean it's a safe product. Has to be very careful before you take it, and talk to someone who is knowledgeable about this before you start if you have chronic kidney disease. So smoking and kidneys, it's clearly there have a couple of studies shown they are not if you are smoking, then it induces the blood vessel stiffness, and then it can last for a long time. So what is so educating and getting them early to is what are the benefits of early education? So as we said, like it prevents from progression, not only of chronic kidney disease and letting it go to failure, but also from other aspect of cardiovascular protection. It also delays the progression of chronic kidney disease, and don't have to go to renal replacement therapy if you can pick them early, and also reduces the healthcare cost to the society. So how do you treat chronic kidney disease? So you treat the underlying illness. If you are diabetic, then you want to make sure that your diabetes is under well control. You treat associated problems. Diabetes just doesn't come by just diabetes. It comes along with a lot of other comorbidities, which are hypertension, hypothyroidism, cholesterol issues. So you need to treat other associated problems. We can help to slow the progression of chronic kidney disease. If the heart disease is already established, then you can try medication, make sure that is treated well. Avoid nephrotoxins, controlling protein leak. There are some special medications which we can use for controlling the protein urea, the protein leak, and that can be utilized. And once once the chronic renal failure is established and it is leading to end stage, then dialysis, transplantation are the choices you can use it. Again, going back to the same, basically if you are at this stage where you are already progressed with the kidney damage, kidney failure, and end stage, the choices have dialysis and transplantation. I just wanted to emphasize on one, diabetic nephropathy, because it's the most common cause of chronic kidney disease. If you have established diabetic nephropathy, check your urine blood and blood pressure on a regular basis by your family doctor. Good control of blood sugar is quite emphasized, has shown in studies as well, helpful. Controlling your blood pressure, there are different recommendations. If somebody wants to know more about hypertension and what targets they have depending on their age, there's the guidelines from Hypertension Canada. Just Google Hypertension Canada and you'll get more information on that regard. And like we talked about this smoking and so on. So if chronic kidney disease is not treated, it will lead you to end stage renal disease, and the treatment choices are limited, and we can just go through a few quick slides about dialysis and transplantation. What dialysis is a process, it will be offered to you if you have a GFR or kidney function which is less than 15, more so less than 10, but some people might need it earlier as well. Dialysis is a procedure where we would clean the blood by using a hemodialysis machine or a peritoneal dialysis. And basically the waste and excess water is removed from the blood by this procedure. It's basically an artificial replacement. It does not replace our natural normal functioning of the kidney. What we are doing is we are trying to just extend by giving you some kind of like taking the waste products, but does not kind of replace your normal kidney functioning. There are two kinds of dialysis. One is the hemodialysis and the second is peritoneal dialysis, and can be done in the home setting or it can be done in the hospital setting. So this is what hemodialysis looks like. Basically, you are hooked up to a machine. There is blood going through this. It gets into this filter. The blood is clean. You have to do 4 hours 3 times a week. That's the minimum which kind of usually one person needs. And it can be done in a different ways, but only can replace, as I said earlier, 10 to 15% of native kidney function. So not really good. So there is a lot of patients with huge mortality when they are at end-stage renal disease. You can do home dialysis as well. Dialysis can be done at home. You can do peritoneal dialysis at home or home dialysis. Basically, peritoneal dialysis uses our own peritoneal membrane as a dialysis membrane. So you put in a catheter into your abdomen and then exchange fluids on a regular basis. Can be done at home while you are sleeping. There is a machine called Cycler which can help you with that, or you can do home hemodialysis. And the last but the best option is a kidney transplantation. But because of the donor shortage, or like not everyone is lucky to have this. So basically, this is a surgery which has a healthy kidney placed in one person, taken off from one person and putting into the other individual who needs it. You can do a living related or living donor transplantation or a diseased kidney transplantation. Living transplantation you have to have a donor in order to get to have a living transplantation. Age you have to be healthy, 18 to 70, and there are ways around getting the blood compatibility or paired exchange program. Ottawa does offer paired exchange programs. If you are not a lucky one where you may not have a donor, then you can go on to the deceased kidney donor list, where a kidney is taken out from person who is brain dead and then can be transplanted into you. You have to go on to waiting list. Average waiting list in Ottawa is around 4 years, so quite long wait list for someone to get kidney donation from a deceased donor. So just to conclude, basically chronic kidney disease is an increasingly recognized health concern. Early recognition and management is the key, and I just put it in the bold that prevention is better than the cure in this. If somebody wants to get more resources about chronic kidney disease, go on to these websites. There is a lot of information out there on these websites. Kidney.ca is by Kidney Foundation of Canada, and Ontario has started, like in last couple of years, network. It's called Ontario Renal Agency or Ontario Renal Network. The renalnetwork.on.ca is the website for that, so you can get additional information. Thanks for the attention.
Before we open for questions, I just want to remind you that 85%, Dr. Biani mentioned the chronic kidney disease in the Canadian population is anywhere between 12 to 15%. That's what he mentioned. But look at the positive side. 85% don't have it. Let's look at that. Rather than looking at the 15%, let's look at the one don't have it. Who are they? Who are they? Look around, and you'll find the answer. Dr. Biani mentioned. Look at the risk factors. Somebody who is, say, 30 years old, I'll take that example. He's lean and thin, ideal weight, no blood pressure, no diabetes, he's not a smoker, he's a saint. What are the chances of that person who says, I am absolutely healthy? What are the chances of that person having chronic kidney disease? Is very small. Now you add another factor. Instead of age, 30, now you make it 70. The risk has gone up. as that was pointed out. The more we get older, the kidney function goes down by 0.5 to 1% every year. So the age coming. Now somebody says, 30 years old, I have got put on weight. Well, getting into trouble. Somebody has, on the top of it now, has a blood pressure. Somebody has, then we are into a difficult situation. So we have 85% of the people who do not have it. Let's look at them. I think that's the message that I want to give it to you. Look at your own self. Make a list. Dr. Biani pointed out, where do I fit into that? Do I have blood pressure? Do I have weight problem? Do I have this? Do I have that? And then, on the top of it, Dr. Biani mentioned annual checkup, a very simple test, a urine test. Costs you no more than few cents, and you certainly don't give any part of your body, just a sample of urine. And I have to ask Dr. Biani here, people do a dipstick test. You know what the lab does. You leave a sample of urine, they put a little stick, look at it, I'll tell you, is there protein, is there blood, what is in it? Now my question to Dr. Biani is, if they say there is a little bit of protein, do we ask for microalbumin? Now there are two fractions, you must know. If somebody says there is no protein, is that person safe? They could have albumin instead of total protein, and tells you a totally different picture. Dr. Biani, any comment?
Yeah, so there is a special test, like if your family doctor is suspecting if you have those risk factors which I mentioned, if you are diabetic or hypertensive, then the urine is sent to the lab to do a special test called urine albumin by creatinine ratio. What that basically will detect is something called microalbuminuria, is that Dr. Jindal is trying to point out that. So if you have microalbuminuria, what that basically means is the cell lining in your blood vessel, that's the endothelial damage is happening, already taking place. So that's the more kind of, again, like basically, like we are picking it up at a very, very early stage, like where you can do things and prevent it from progression. So that's, I think, she was.
See, just look at the other side. Dr. Biani pointed out, when you have a kidney disease, you may have other systems also affected. So let me give you an example. You go have a physical examination. At the end, urine is tested. You have microalbumin. What does that mean? Does it mean only kidney? No. That's the point. The blood vessel in the kidney is leaking protein. These blood vessels are the same all over the body. So if it is happening in the kidney, it is happening in the heart, it is happening in the brain, it is happening in the eyes. So we say if you have microalbumin in the urine, your risk of dying from heart disease is 4 times. Is that fair?
Yeah, that's a very important point which Dr. Jindal had, and that's kind of something to emphasize. It's just not the kidneys. If you are detecting protein or albumin, as we said, in the urine, that is like basically a symptom of everything going wrong in other circulation as well, like your brain or cardiac. So it's just like you are seeing inside what's happening in the blood vessel.
Questions to Dr. Biani?
Is it hereditary?
Yeah, go ahead, stand up.
Is this inheritance plays a part in the kidney disease?
So there are some hereditary conditions which can play a part, which I didn't go into more detail. There are certain conditions called polycystic kidney disease or Alport syndrome. So if you have any family member who have been diagnosed with this, it's a good idea to kind of, again, talk to your family doctor, go through the pros and cons about kind of whether we want to investigate or not these conditions.
Yes, Doctor.
How reliable is the dipstick test?
So that's the most common test, but like for someone who have a high risk factor, it would be always nice to at least have once kind of do that albumin by creatinine ratio to rule out microalbuminuria to detect it early. So not necessarily always it can pick up like small amounts of albumin or so.
What's the normal blood pressure?
Yeah, so that's kind of a very interesting question. Normal for whom is the question. Like normal for like each age group, the normal is different. And again, as I said, the guidelines again take into account ongoing studies and so on. Generally, we say 140 over 90 or less would be normal. But again, if you are having a risk factor like diabetes or something, then you will drop down to 130 or 80. There is a very good educational tool on hypertension.ca. Go on that website. It gives you all the information about for your own individual risk and so on. You can do like an basically go through all, like they will ask you 10 questions and give you what is the individual risk. Go ahead.
Can you explain on this water, taking more water or pushing out?
Yeah, so basically what like I have seen a lot of patients coming and talking to me and saying that we drink 4 liters of water, 5 liters of water, and it is helping to just flush the kidneys well or something. There have been couple of studies, not necessarily very good studies, but they have been done, and they have not shown any major benefit with, when they compared that with people who were just drinking on the basis of our thirst mechanism. Thirst mechanism is a very important mechanism, and it is the brain sensing what is the osmolality. It will like get you, and so just drinking on the thirst mechanism itself is good. But like generally we say 2 to 2.5 liters, unless you have some medical problems like stone. If you have kidney stones or something, then we would recommend higher amount of fluid. But just to drink to flush the kidney and to get the kidneys healthy is not necessarily like they are backed up by research.
Doctor.
I have two questions.
Yeah.
One is that certain viral diseases
Okay.
can affect the kidney. So, if you get a viral attack,
Yeah.
the GP should do a kidney function test. Do they generally do? Are they well educated so that they know these things and order that? That is one.
Okay.
The other thing is a simple question. Are there any kidney protective foods?
Fruits.
Food.
Okay. Okay.
Say through.
Yeah.
You talked about lifestyle.
Yeah. Yeah.
Are there anything
Sure.
which is good for the kidney?
Yeah, sure. Yeah, we can. So for the first question about the viral, you're right. Like there are certain viruses like hepatitis B, hepatitis C, HIV. Those are associated and proven to be associated with kidney disease. Now general flu and so on, like there is an entity called as post-infectious glomerulonephritis, where you get inflammation of the kidney after any infection. It can be, most commonly it is associated with streptococcal infection, but can be other illnesses as well. Now, like they not necessarily do the kidney function test because it's completely, 95% completely recovers. And some of the patients, it might have lingering effects for some time. But it's not kind of a recommended test for a general viral infection, like to have a kidney, unless you are showing some symptoms or so. To answer your second question about fruits, so there is food. So DASH diet, there is something called DASH diet, which has been shown. Basically what it means is eating healthy vegetables and fruits over grains and sugars and so on is definitely shown.
So vegetarian is better than non-vegetarian?
I will not go into that. I would not like to go into that.
Okay, see, DASH diet, which Dr. Biani mentioned, it's very simple. It doesn't say that you don't eat meat. All it says, cut down your salt. Second, very important part, fruits and vegetables. And the third part is cut down the meat. So that answers partly your question. Vegetarian and non-vegetarian. By the way, Dr. Biani is strict vegetarian.
So I'm not.
Go ahead. Any other questions? Sorry, go ahead.
The presence of protein in the urine and albumin,
Yeah,
is that sure indication that
yeah, it is a
kidney-
sure indication,
the
yeah.
kidney is not functioning?
Exactly, yeah.
No, no,
If it is a-
wait a minute. It's a sign that the kidney is damaged.
Yeah.
Function may still be normal.
Okay, so it needs to be tested further?
Yes.
So you are in that stage 1 or 2. When I said that 5 stages, like damage means you are in stage 1 and 2.
Thank you.
Yes, please.
I have a question about, after having lunch you feel like sleeping.
Yeah,
Is it bad heart or bad kidney or what? Is there something related with that?
for sleeping,
Yeah, like after having lunch you feel like having nap.
I think
No.
because the blood circulation is more towards the stomach, then so you might feel a little, but nothing to do with the kidneys.
No.
No, nothing to do.
And nothing to do with the heart either.
Yeah, yeah.
Oh, okay.
Any other question? Yes, Pradeep?
When a person is diagnosed with a kidney disease,
Yeah,
is it linked to the both the kidneys or?
yeah, usually it's both kidneys, yeah. Unless you have an obstruction on one side or so, and you've been diagnosed that your unilateral kidney can fail, if you have a kidney stone which is blocking that kidney, but usually, like when I describe the systemic illness like diabetes and hypertension, it's both the kidneys.
I think this is the point. Diabetes is number one. 40% of our patients with kidney disease due to diabetes, it does not spare. Both kidneys are affected. Same goes for blood pressure. Put these two together, it is 70%. Yes, please.
What percentage of the general population will have a congenitally be born with, when you say one kidney in the general population?
Yeah, I would not be able to give you a particular percentage kind of thing, but like born with one kidney, like there are like studies done 30 years, 40 years down the road for people with born with one kidney, or not born with one kidney, but who had donated the kidney, like kidney donors. There have been long-term studies and they have shown relatively very, very low risk of developing any risk factors. There are some studies out of Europe which have shown a slightly increased risk of hypertension, but it's still debated in the medical community.
I think this is the point. This was a Swedish study, 30 years longitudinal follow-up of people who donated kidney. So you're left with one kidney. 30 years back. What will happen 30 years later? Nothing happens. Except maybe small chances, few developing little blood pressure. So it's very safe. Yes?
Doctor, is there any issue with what type of painkiller you take? Like aspirin, Tylenol?
Yeah, that's a good question. So basically, Tylenol is supposed to be safe in moderate doses. Like if you're taking too much, then it can cause liver toxicity and so on. So you don't have to take too much. But Tylenol is usually suggested to be safe. If you need more than Tylenol, then you'll have to move on to morphine or morphine derivatives like codeine and so on. But Advil or Aleve or common painkillers which are described as non-steroidal anti-inflammatory NSAIDs, they are not safe from the kidney point of view. And again, I would like to emphasize on the point, if you have a normal kidney function and if you need to take a couple of them just for if your pain is not managed, it should be okay. You don't want to kind of have to suffer just but people who have advanced chronic kidney disease, then it's contraindicated.
Last question.
People born with the one kidney,
Yeah.
they live longer?
No.
There's no.
Okay. Sorry, last one. Sorry, go ahead.
Sure.
Excuse me, please. Please.
So generally, there are some side effects, and I know there is a lot of things out in press about statins, like one of the cholesterol medication called statins and the side effects associated with it. Like when we prescribe statins, we would, there are two major toxicities which we are worried about. One is muscle toxicity and the second is the liver toxicity. So we do get blood tests done for these side effects. But generally, if they have muscle breakdown or something, then they can cause kidney problem, acute kidney failure. But generally, they are thought to be safe from kidney point of view, because it's kind of helping with the atherosclerotic process.
Just to conclude,